Guys, it's Dr. James Simcock here from VetDojo, just doing a short video on some imaging that we did on a French bulldog that actually had spinal surgery on Tuesday. And I live streamed the surgery, and it was one that was interesting, and I talked about in the live stream surgery about the changes, the congenital abnormalities present in the spinal cord, and promised that I would endeavour to get some of the CT imaging put up for you. So I've got a couple of images here. I've actually manipulated the CT images a little bit already. We've done a mean of the imaging on the three-dimensional reconstruction here, the multiplanar reconstruction. So we're looking at a sagittal section through here, a frontal plane, and then a coronal section through here. And what we can see is, and we'll show you a bit better, there's these vertebral bodies down here which are normal, and then we get through this section here in the caudal thoracic spine where things get a little bit abnormal. And we've got multiple hemivertebrae and block vertebrae and butterfly vertebrae in this region, and what that's causing is some kyphosis in the spine, which is the bending in this direction. And interestingly, there's also some scoliosis in this guy, so the spine comes down and then makes a couple of bends and looks a bit like an S shape there. So it's interesting with these brachycephalic dogs, these congenital changes are fairly common in the spine, but they are often not necessarily associated with neurologic disease. So when these guys present with acute onset pelvic limb issues, paparesis and weakness and things like that, neurologic deficits, on the CT scan we'll often image them and see, yeah, very spectacular changes, but those congenital changes are not necessarily responsible for the compression. And what we found in this dog is that there was a very large disc extrusion, and I'll just have to find it as we scroll through. So we're looking at his vertebrae here. I'll just change the imaging a little bit. So we're rolling through his neck. We can see the myelogram here, vertebral bodies surrounding that as we go through. And then as we start to get to the interesting section a little bit further down, coming through his cranial thoracic spine here, I'm just going to stop that there, just change the windowing a little bit. There we go. And when we get to the caudal thoracic spine, we'll start to see these vertebrae become very abnormal. So as we're rolling through, we can get the impression that each of these vertebral bodies is fairly symmetrical and a normal shape. And then we get a little bit further caudal around here where things start to get a bit weird, and we can start to see that these vertebral bodies are quite abnormally shaped in this location. What we're interested in though is not necessarily those changes causing compression. We can see that we've got the contrast around here, around the spinal cord, and everything looks okay. But as we get a little bit further caudal, we can see that there's a very large disc extrusion, which is just going to come into view in just a second. So right about here. And you can actually see this is all disc here pushing on the spinal cord all the way over here. So it's a really large, actually gets a little bit worse. So this again is all disc material here, squishing the spinal cord all the way up in the corner here, and is a very, very impressive disc rupture. Then we get back just behind that area and things become a bit more normal again. And we've got contrast around the spinal cord. So you can see a very, very large extrusion pushing on the cord through here where the disc is ruptured. And as we come further cranial, we can see that through the area of the congenital abnormalities, through here we've got good contrast around the spinal cord, and that's really not any area of significant compression. So just wanted to show you that it's a pretty interesting case, and one where it's got some very severe congenital abnormalities, and just again to highlight when we see those abnormalities that it may not necessarily be associated with the spinal cord compression. We need to look for a disc rupture or some other reason. So hopefully that was interesting. It's worth checking out the video that I put up on the hemilaminectomy, and if you have any questions or comments, just let us know. Thanks guys.